you.
And welcome back. It's 12:32, and I'm super excited to have our next guest on air. She's a specialist allergist and asthma care provider. She's practiced as a general practice allergist with a special interest in immunology. She also has extensive experience in pediatrics, intensive care, and allergies. A particular interest in the confluence of autoimmune, allergic, and primary immune deficiencies. Her scientific basis is rooted in genetics, and her fascination with the beauty and aberrations of immunology stem from our building blocks, she says. She's the first South African doctor to hold a master's degree in allergies, and obviously her speciality would be specialist allergist. She's an asthma care practitioner, also pediatric care, including vaccinations. And of course, that's for another conversation, very especially with COVID vaccines making world headlines, but we'll talk about that another time. And she is an immunologist in the making. It gives me great pleasure to welcome to the show, and I hope it's going to be many, many more such sessions with our esteemed guest. She's Dr. Roz Rabie. Good morning or good afternoon. Welcome to the show.
Thank you so much, Juliana. Salam alaikum. How are you?
Wonderful to have you on the show. I'm so excited. I don't even know where to begin because I was going to talk to you about autoimmune diseases, and I see you have so many other areas of interest, but I do hope and pray you're going to join us again sometime in the near future to talk about so many other important medical matters. So let's start off right at the beginning, even before I start the interview. Where are you based, Dr. Roz?
So currently, I work from the sessional rooms at Santon Mediclinic in Bryanston.
Okay, great. So if anybody does want to consult, they go via Santon Mediclinic. Okay, brilliant. I want to talk about autoimmune diseases, which is, I assume, also of interest to you. Would I be correct?
Yes, absolutely.
All right. Let me ask you the first question. I know the most common ones, and time permitting, we'll try and uncover them. The very common autoimmune diseases are your rheumatoid arthritis, psoriasis, lupus, shingles, and all of that. But I was talking with someone recently, and she said to me that she has borderline autoimmune disease. What on earth is that?
So usually that would mean somebody who might have very low levels on testing. So, for example, one of the tests one would run for lupus would be something called an ANA test, so an anti-nuclear antibody test. So perhaps this lady might have very low positive levels, and that might have been explained to her as borderline autoimmune disease. Or maybe if she has features of rheumatoid arthritis, maybe her rheumatoid factor was very low. Thyroid disease is also autoimmune disease,
yes.
And in fact diabetes as well.
Oh, really? I didn't realize that. So when the suggestion is that very low levels of the particular condition, would it then mean that perhaps later on in life, or if she's in a very stressful situation, because we know stress does tend to aggravate any medical condition that you have. So if she finds herself in a very, very stressful situation, would that borderline then possibly blow into, kind of your full-blown lupus or whatever it might be?
Yes, so stress certainly can. It's an interesting phenomenon. We find that, one, as we age, the disease can progress, or it can reach a plateau.
Oh.
But then when patients are very stressed, so for example, pregnancy for women can have the disease go into remission, or it often accelerates disease. So lupus can be accelerated in pregnancy, for example, or rheumatoid arthritis. But certainly major life stresses. So, for example, if one now had to get a disease like COVID, and certainly severe COVID, we don't have data yet, but certainly in the next couple of years, we might find that patients who have autoimmune disease might have had an exacerbation of their autoimmune disease. And we certainly see that with the type 1 diabetics who have the diabetes, which is an autoimmune disease in type 1. Major life stresses for them can exacerbate their diabetes. So we know that these patients, if they get COVID, they are at extremely high risk. So that certainly has been associated. And even things like death within the family, and if patients get, retrenchment and those sorts of things. So it's the stress.
The trauma, I guess, any trauma would possibly trigger it.
Absolutely.
Okay, two things that I do want to say here is I really didn't realize that type 1 diabetes was an autoimmune disease. I always understood it to be obviously the genetic factor being there, but lifestyle. But you will correct me, or you will put that into perspective for us. Having said that, let's first understand what exactly we're talking autoimmune disease. What is an autoimmune disease or disorder?
So I'm first of all not an endocrinologist. I'm not a specialist in something like diabetes, and I'm not a rheumatologist. But in simple terms, from an immunology perspective, autoimmune disease is when your body immunologically attacks itself. So if we think of the immune system as the basis of how we protect ourselves from invaders, but the other part of the immune system is self-recognition. So I recognize myself, and I have to protect myself from the external world. When things go awry, one of the problems is that I no longer recognize myself. And either I will then attack my own pancreas in terms of diabetes, or I will attack my own joints in terms of rheumatoid arthritis, or I will attack my own thyroid in terms of thyroid disease like Hashimoto's or Graves' disease.
Okay. Also, we'll talk about the symptoms, and we'll talk about risk factors and the type of treatment options available. Let's look at, and we don't need to go into too much detail, but if you are plagued by one type of autoimmune disease, does that suggest then that you are vulnerable to perhaps contracting other autoimmune diseases as well? So perhaps you have diabetes, you have diabetes, and then you're a strong candidate for perhaps lupus or rheumatoid or psoriasis or whatever the case, whatever else falls under the umbrella of autoimmune diseases.
Absolutely, and we certainly see that. I often tell patients when they've been diagnosed with thyroid disease, for myself, that's certainly a red flag that further down the line they will often present with other autoimmune diseases. Even if it's very mild in the beginning, certainly 5 to 10 years later, they will often present with another autoimmune disease. And there's crossover with the testing as well. So sometimes it's a little difficult to tease out which disease you're dealing with. I think in life and in medicine, it's always easy if things are very defined and one can box them. But in medicine, we're realizing with immunology, things are a lot more complicated. We were taught at medical school that you have the innate immune system, which is the kind of first line of defense, which is non-specific, and then the adaptive or advanced immune system, which is very specific. But we now realize that those borders are very blurred, and with COVID, that really elucidated a lot more information. And similarly, in terms of autoimmune disease, we've realized that there's features of autoimmune disease which actually involve something called autoinflammation, where that autoinflammation even involves things like immune deficiencies for some patients. So they have the one aspect where their body attacks itself, but on the other hand, they also can't defend themselves against infection. So it's a very fascinating environment where things are not as clear-cut as we thought they used to be.
I want to also look at the link between, if you have an autoimmune disease, does that mean, when we're talking about your cells, your own cells attacking, your healthy cells attacking other healthy cells, so to speak, that you would you be a candidate to some form of cancer or the other? Is that a possibility?
Yes, absolutely.
Ooh, what a double whammy.
Absolutely, unfortunately, yes.
Oh, my word. We're going to have to take an ad in a minute or two, but, the reason I'm talking with you today about autoimmune disease, and it's always very interesting with us, radio talk show hosts, you come across people in life and they say to you that I'm going through this and I'm going through that. And then you think to yourself, that would make a great a topic of a discussion. And then, you do a bit of research and get specialists like yourself on and unpack it more, and then be more understanding of your loved one or your friend or the community member or whatever the case may be. So I'm going to ask you a few questions and then leave you to formulate your answers whilst we take an ad break.
Okay.
I've heard of Raynaud's phenomena, pernicious anemia, and lichen sclerosis. So now I've been told by this person, she suffers from all three. Are these all autoimmune diseases? It looks like she can live with the Raynaud's phenomena, and you'll tell us, for the benefit of the listeners, you're going to tell us what that is. Pernicious anemia as well. And now she's presenting with lichen sclerosis and has been told by her doctor, or rather her gynecologist, that best they do a biopsy. And she's been warned that it's a very painful procedure. It's going to be done under general anesthetic. It's like giving birth to a baby, because she's going to cut away tissue and she's going to singe all those whiteheads in that area, etc., etc. And the reason she's suggesting the biopsy for the lichen sclerosis is that she wants to rule out the possibility of vulvic cancer. So I'm leaving you with a whole host of things to respond to me right after the ad break.
Okay.
You are listening to the Mid-Morning Talk with Julie Alli.
Penny Appeal are doing something special. They're giving you the chance to make sure that 100% of your zakat is going to help people who are in desperate need. So this year, give 100% of your zakat to poor and needy people with Penny Appeal, and reap the rewards of fulfilling this beautiful pillar of Islam. Penny Appeal. Small change, big difference.
Spread the sunshine and make mealtimes sunshine delicious. Sunshine D, the versatile margarine and fat spread that is perfect for spreading, baking, and cooking. Need inspiration? Visit nowwecooking.co.za.
What makes Randery Jewelers the optimum place for your memorable gift? Is it our range of exclusive, high-end, luxurious jewellery? Or is it our master craftsmanship of all your bespoke jewellery needs? We believe it's because at Randery Jewelers, we know just how to make your special moments last forever. Whether it's for a wedding, anniversary, or just a simple gift to show your love, trust Randery Jewelers to make it special. www.randeryjewelers.com. Make your moments last forever with Randery Jewelers, the family name you can trust.
This is the Mid-Morning Talk with Julie Alli.
I'm back again. It's 12:46, and I'm so pleased to be talking with this amazing doctor, Dr. Roz Rabie. She practices at the Sandton Mediclinic if you would like to consult with her. And I'm hoping and praying that we will be featuring her more and more on our show if she is if she is willing to talk to us on a pretty regular basis once in 2-3 weeks, I will be absolutely thrilled. Dr. Roz, I'm back. So those conditions that I spoke about, Raynaud's, pernicious anemia, and lichen sclerosis, do they fall under the ambit of autoimmune diseases?
Yes, they do. So I'm going to talk a little bit about the pernicious anemia first. So there's loads of information, but briefly, the patients develop a vitamin B12 deficiency, and it can also lead to problems with the spinal cord. And the worrying concern is that they can have gastric carcinoma.
Sorry, I lost you there. What carcinoma? Which is a cancer, obviously.
The stomach.
Cancer of the stomach.
Yes, that's correct.
All right. I think let's, all right, for the purposes of the show, we'll rush through this, but I'm hoping to get you on in the future, and then we can go into finer detail with all of these conditions.
Yes.
Yes, carry on, Doc.
So just in terms of it being an autoimmune disease, they develop antibodies to the lining of the stomach. So that's where the link comes in with the autoimmune disease.
The Raynaud's phenomena?
So Raynaud's is an interesting scenario. It is very common in autoimmune diseases, and the short answer is that you having problems with circulation to your hands and feet, and very often to the feet. So the hands and feet feel very cold, and often in cold weather, they turn different colors. So white to blue to red. So as the hands and feet would warm up, then they turn a reddish hue. And it's often also an early sign that you may be dealing with a patient with autoimmune disease.
Okay, so this all ties in with my question.
Absolutely.
Lichen sclerosis. So this picture that you're getting of this patient is definitely telling you that she is suffering from an autoimmune disease, which could very well then present in some form of cancer. So let's look at the lichen sclerosis.
Okay, so lichen sclerosis, it is a little bit more complicated, and it's usually one finds that it is more common in women, often presents in areas of gynecological tissue, so often in the vagina, and that's probably why she's presented to the gynecologist. And there is a preponderance to developing gynecological cancers in that area, and that is why the gynaes will want to do a biopsy. And it's quite difficult to delineate, kind of where the disease process ends and where the cancer begins. You can also have lichen sclerosis in the mouth.
Oh,
yes.
Okay. And how does that present? How would you know that you've got lichen sclerosis in the mouth? Let's talk about the symptoms in the gynecological area, the vagina for that matter, and then in the mouth. How would it present?
So often the patient feels quite uncomfortable, and it feels a little bit like the burning sensation, but you find that, unlike, for example, yeast infections, there would be no discharge that the patient notices. When the gynecologist examines you, they'd find certain features, often areas of sort of lighter or white patches, and then it concerns them in terms of cancer. It's quite a difficult diagnosis to make. In the mouth, similarly, there might be lighter areas. Often you present to the dentist with a burning sensation in the mouth. It's quite difficult, obviously, to do biopsy in the mouth, so patients would then go off to a maxillofacial surgeon. But it is very difficult to treat. Often patients usually start off on cortisone therapy, And in the vaginal area, they often end up having other treatments. They may even end up having chemotherapy modalities and so forth. But it is quite difficult to treat the lichen sclerosus.
How common is it, and what does the prognosis look like in terms of, the sooner you undergo treatment? Is there time to play, so to speak? How much time from the time of, I guess that's a very difficult question to answer because you wouldn't know how far the disease has progressed.
So, yes, I think I'd rather leave that question for a gynecologist. They would be better poised to answer that question. But I think it is one of those diseases. It's a bit like ovarian cancer. The presentation is very sort of non-specific. So patients may even leave it for quite a long time because they just feel it's uncomfortable, or they might be a little bit embarrassed. So they might actually present quite late. And then, once you've done the biopsy, the diagnosis comes in quite late. So I couldn't give you an accurate figure in terms of how common it is, but it tends to be one of the rarer diseases. And then depending on how advanced the disease is, one would choose the treatment modality.
Why? All right. So we know it's an autoimmune disease, and your healthy cells are attacking each other or other healthy cells. And this is what's happening. Caught early enough, can these conditions be cured, or is it incurable? Do you just kind of live with it for the rest of your life on chronic medication, perhaps?
So, as with any disease, if you catch it early enough, you can manage the disease. At this stage, there is no cure for autoimmune diseases. But yes, if your diagnosis is made early enough, one can manage the disease. Most of them are initially treated with corticosteroids, or more in layman terms, cortisone, which is not the most ideal drug. It works very well, and it works very well when patients have a flare-up of the disease. So a sudden sort of deterioration of the disease, and the patient feels really unwell. But cortisone has a lot of side effects, and some of those side effects can even be irreversible. So one would prefer not to keep the patient on it for a long period of time. So then there are what we call disease-modifying agents, and those drugs commonly in South Africa, for example, rheumatologists and endocrinologists might start patients on things like methotrexate or plasminoquin, those sorts of drugs. But it does depend on the disease. So, for example, patients with thyroid disease might be started on something like Altroxin or Euthyrox. And then obviously the diabetics are started on their anti-diabetic agents or on insulin. But there is sort of a step ladder of medications that patients would be put on. And what's happened is in the last few years, there are now very specific medications and advanced medications called monoclonal antibodies. Unfortunately, they are almost prohibitively expensive. And the medical funders in South Africa want evidence that the patient has proceeded through the ladder and has failed previous therapies before they will permit these very expensive treatments.
By which time you half did already.
Yes.
Oh, goodness me, the system. All right, we have a caller wanting to know autoimmune disease risk factors. What would they be?
So one of the risk factors is genetics, is family history. And often I ask patients a broad history. So if, for example, you say, no, well, I don't think my parents had the disease, I say, okay, well, what about your siblings? What about cousins, aunties, uncles, grandparents? And so it's further along and further up the family tree. So just because our parents didn't have it doesn't mean someone else in the family didn't.
Oh, so if a first cousin or a second cousin also, if our parents haven't, if our parents didn't have the disease, but it's found that a second or a first or a second cousin had the disease, you are at risk.
Absolutely. And some of these diseases have an infertility component as well. So I always ask the question whether somebody's had miscarriages or has struggled to fall pregnant. There is a link between endometriosis and autoimmune disease. So I always ask whether, especially if it's a female patient, whether they've had struggled with endometriosis.
Okay, another caller wanting to know about lichens. How long, if the person has just been diagnosed, how much time, if they want to first try out conventional medication like the cortisone that you have suggested, how long can they kind of test that before they decide to go for a biopsy?
So I would suggest the other way around. Do the biopsy first and confirm the diagnosis, and then do the treatment.
Okay, that's your suggestion. Right. So we've almost come to the end of the show today. There's just so many more questions to ask you. This disease, any autoimmune diseases that we've touched on, we haven't gone into detail in any one of these, that we've just kind of skimmed through. Are any one of those curable, or is it a chronic disease?
They are chronic diseases, and some can accelerate very quickly. So one of the diseases that often accelerates quickly is called scleroderma or systemic sclerosis. Unfortunately, it affects many different parts of the body, so not just the skin and the joints. It can affect the heart, the lungs, the kidneys, even the nervous system. So that's one really doesn't want to be diagnosed with. But even rheumatoid arthritis can affect the kidneys and the lungs. So, many of the diseases, if one can be diagnosed early and be treated early and managed early, then it is better. And lifestyle is important. I think, it is psychological support. If one can manage to do exercise, one needs, to maintain an element of spirituality. I think that's very important. Then one manages one's disease alongside your treatment regimen, and having a healthcare provider that we have a good relationship with. I think all of those things make a huge difference to managing your disease.
One final question on the lichen sclerosis. So if the patient goes for the biopsy, two scenarios. She could be clear. No cancer is picked up. But if cancer is picked up, then she will be referred to an oncologist to start treatment. Would that treatment be, depending on how aggressive the cancer is, obviously, would it be chemotherapy or a combination of chemo and radium, or how does that, how do you move forward on that?
So in some cases, the gynecologist can actually remove quite a bit of the cancer, and then the oncologist, they make a decision, usually as a multidisciplinary team, in terms of how they would take the treatment forward. So usually in that area of the body, they are quite reluctant to do radiation. Unfortunately, sometimes they do, but they usually make a multidisciplinary decision in regards to how they will treat the cancer.
Why is there reluctance on using radiation on that part of the body? Is it because of the burning, or
the side effects that can happen? Obviously, it's a very delicate area of the body.
Right.
And, with radiation, there are consequences like, even burning. I mean, even for things like lung cancer and so forth. It depends. I'm not an oncologist, but it depends on where one's cancer is. And there are still, although they've refined radiation, but it certainly has consequences.
Absolutely.
Like burn injuries. And obviously, in that scenario, one doesn't want burn injuries in that area to the body.
Absolutely not. Dr. Roz, it's been an absolute pleasure talking to you. I know we didn't go into much detail. We've kind of skimmed through autoimmune diseases, and we've just kind of touched the surface on cancer. But no doubt we will talk again with you soon, and then going to, we'll choose subjects and go into much detail with the particular subject matter. But thank you indeed. You've given us a lot to think about. And we do hope to talk to you again soon. Dr. Roz Rabie, a general practice allergist with a special interest in immunology. She does have sessional rooms at the Santon Mediclinic. Do you practice anywhere else, or do you only have your sessional rooms there?
I only have my sessional rooms there for the moment. Unfortunately, with the pandemic, Juliana, a lot of doctors' rooms were hit very hard. And I had to give up my office in Parktown North. But, I am looking out to having my own rooms again shortly. So,
Okay, good.
So
I do hope that we'll be able to talk to you again soon. I so enjoy talking to you, and I've learned so much in the short half hour. God bless. Thank you once again, and go well.
And you too.
Thank
you. I look forward to chatting to you again. Have a lovely day.
Wonderful. Bye-bye. And there we leave it with Dr. Roz Rabie. What a pleasure to talk to someone so very knowledgeable about so very many different medical issues. We will have her on again soon. It's time for me to go. 4 minutes over my time. Thank you for being with me. Hope you've enjoyed the interviews as much as I've enjoyed your company. Till the next time, as always, Assalamu alaikum.